Hi, this is Dr. Humayun, and you are watching Heart Surgeon's Diary from London. Today, we are going to talk about blood pressure, very basics of the blood pressure, its simplest definition, what different types of blood pressure are there, and what are the latest guidelines about what is the normal blood pressure, what is the elevated one, and what is hypertension, which we label a reading of blood pressure which needs further treatment, and what damages it can do when it is high. I've tried to make it as simple as possible for the layman people or common people to understand these medical terms so that they can get the maximum benefit from these vlogs. In the later vlogs, we will also discuss what different types of lifestyle changes or things you can do other than medicines to control this blood pressure, or either to prevent it or to reduce it. And similarly, we'll discuss about heart diseases, we'll discuss about obesity, its control, its damages, kidney diseases, and all sorts of other medical problems in a very simple, easy to understand way. And I will try to guide you what you can do and when to seek medical attention, or what things you can do at home to prevent or treat those conditions. So please subscribe to this channel and share it with your friends. Also press the bell icon so that when I load a new video or new information, it reaches to you as soon as it hits the public forum. So let's start about this blood pressure. What is blood pressure? So it's in the simplest form, it is the pressure which is caused by blood within your arteries. Arteries are the blood vessels or vessels which takes blood away from your heart to your organs in the body. Except of course lungs, but let's not go into that complicated thing. Let's keep it simple. So there are two types of blood pressure. For common people, it's systolic and diastolic, and there is a third, and of course few other measurements which we use as a doctors in our clinical settings, like mean blood pressure, which is diastolic, plus one third of the difference between systolic and diastolic. But let's keep it simple. Let's discuss about systolic and diastolic, which are the two readings. The upper blood pressure is called systolic and the lower blood pressure is diastolic. So what happens is when the blood pumps or pushes the blood in the blood vessels for it to reach different organs in the body, it reach a peak in the arteries, which is the highest, the top, which we call as systolic blood pressure. And then once it drops down, the lowest point is called the diastolic. So it is in the form of a wave. So upper point is systolic and lower point is diastolic. So many people ask which is more dangerous. Both are, if they are high, both can cause damage. So you need to consider both of them. And we'll discuss the readings for both of them, which are normal and which are higher. Then comes that how to measure this blood pressure. Now there is a lot of confusion about this, what reading, how to measure, and what to do. Although it looks very simple if you know it, but it creates a lot of confusion among the medical community as well as among common people. So the best way to measure it, that if ideally these days we recommend that it is measured at home, which is called HBPM, home blood pressure monitoring. Or if it is prescribed by a medical practitioner or a doctor, we call it ambulatory blood pressure monitoring, which are automatic devices. The difference between the two is just that the ABPM device is an automatic device, which is like a holster. You put it there and the cuff is already put to your arm. It stays there for a few days, ideally 3 to 7 days, and it measures at least 2 readings during the day, in the morning and the evening automatically. And then these days we have this system where it sends automatically to your through the Wi-Fi and to your doctor, and record. He keep an eye on that. But there is an easy way and simple way these days. You can get these devices from the market, which are quite good. Most of them are very good, and you can measure your blood pressure yourself at home. It's just pressing one button of that device and putting the cuff on the arm. So let's discuss how you do it. So the first thing and most important thing is that the cuff of that blood pressure monitor shall be the right size for you. So there are measurements written on those cuffs. You check those measurements according to your height, weight, age, and like age means for the kids there is a different one, but otherwise it's the arm circumference and your height and weight. So you will see those written on the cuffs, and you choose the right cuff, and then you shall be sitting comfortably on a chair with your feet flat on the ground and arm bent at elbow at a comfortable position. You put your cuff around your upper arm, and according to the instructions, there are instructions written on the cuff and on the device itself. So use those instructions, you put it on, and you shall not be anxious, you shall not be exercising before that. You should have been sitting there easily, comfortably for a few minutes, ideally 5 to 10 minutes, while you check your blood pressure, because what we want is your normal baseline blood pressure. That's what we want to get actually. Because otherwise blood pressure always goes up when you are anxious, when you are exercising, or when you have heard a bad news, or different sort of thing. When your heart starts racing, your blood, everyone's blood pressure will be high. So what we want is the normal baseline blood pressure when there are no as less external influences on you as possible. That's why these days home blood pressure monitoring is considered as better than the clinic ones, because we noticed white coat hypertension in the olden days, we used to call it. And then we used to consider that, or we still think that there is 5 to 10 mmHg of difference between home and the clinic one. We used to take it away in the past, but these days, if there is a confusion, we recommend this home blood pressure monitoring either through ambulatory support, or that is automatic devices, or using these blood pressure monitoring equipment at home. So what you need to do is that you shall be sitting comfortably, you put your blood pressure, and then you take two readings about 1 minute apart, and on both sides, one side first and then the other side. If there is a difference between the both sides, you shall ignore it if it is less than 10 to 15 mmHg. If it is more than that, then you shall repeat it. And if it comes out the same, then you shall take the higher reading. Similarly, you shall repeat the whole process again in the evening and the morning. So there shall be two readings every day, and you shall measure it at least for 4 to 7 days to get the best possible reading for you. Now, let's discuss what are the abnormal readings, what are the normal readings. Now, what I have done there is, if you look at internet, of course, many literate people try to go and find information themselves on the internet, and they get confused that there are so many different guidelines, there are different societies, many of them. There is American Heart Association, American College of Cardiology, there is European Society of Cardiology, there are NICE guidelines in UK, and all that. These are the major ones, but there are many other, International Society for Hypertension and all that. So what I have done is that, and they have all their made simplified their own definitions of different range of blood pressure, stage 1, stage 2, and there is a difference between American and European ones. But to make it simple for you, I have just take away that stage 1, stage 2 hypertensions or elevated blood pressure and what is normal. Let's just discuss reading wise what the range, so that everyone everywhere can understand what we are talking about. So let's see. So and I've combined all those, the latest guidelines from all those societies, and that's what I have concluded to. So if your blood pressure comes up, the systolic less than 120 and diastolic less than 80, there's nothing to worry about. That is the ideal blood pressure, what we call it as. However, if your reading comes up between 120 to 130 of systolic and lower is 80 or a little bit above 80, we need you to keep a very close eye on your blood pressure. You shall monitor it more frequently, and if possible, you shall start doing your lifestyle changes now, because this is the time to prevent it from further going up. However, if it has come up more than 130 to up to 139, and the diastolic blood pressure has gone above 80 up to 89, that means that you need to now intervene. There is no choice. This is, you have to do it, and that is lifestyle management. You need to do things which we'll discuss in the next vlog, because that is a big detailed topic. We'll discuss in detail that what things you need to do to keep it there, or at least, or if possible, lower it down to bring it to the ideal blood pressure range, that is 120/80. But at least your blood pressure target, that is for everyone, is less than 130/90. That is the target. And that you do up till 139 and up till 89 through lifestyle changes. Above that, there is a difference between Americans and Europeans. You're above 140 up till, there is a difference 160 and 180, and similarly at the lower blood pressure from 95 to 100, and then 120. Above 180 and 120, there is consensus that this is a hypertension crisis, which you shall immediately rush to hospital to prevent any acute damage or immediate damage. Below that, and between 140 and 90. Now, Europeans suggest that you shall do very strict and very hard lifestyle changes for 3 months and try to see if that helps you to bring it down to your target blood pressure, which we discussed is 130 by less than 90. However, if you fail that, then there is same recommendations as Americans, that you shall go on, you shall seek medical advice and start taking medicines. Americans are more stringent about this. They start medication straight away after 140/90. So that is a simplest way to explain this guideline. However, if you have an associated, which we call in medical terms comorbidities, or in normal terms is associated problems like diabetes mellitus, like obesity, like you are a heavy smoker or even moderate smoker these days, or you have calcium in your blood vessels, which has been put as a label of 10% risk of coronary artery disease, or you have a coronary artery disease, or you have a peripheral vascular disease, or you had suffered with a stroke, or you are above 65, or in Europe we call around 80, then even above 130/90 or above 130/80 with some conditions, you need to be on medications, because we can't take risk. That way your risk will be very, very high than the usual normal people who do not suffer with these diseases. So this is I have concluded all those latest guidelines, which has come out for you guys to simply understand what to do and what is normal and what is abnormal. What happens if you don't do anything? This high elevated blood pressure can cause you heart disease. It can cause stroke, that is a paralysis, or losing power to any part of your body. It can cause a vision loss or affect your vision. It can cause coronary artery disease, as we discussed, heart disease. It can cause heart failure. It can cause your kidney failure or affect your kidneys. It can reduce your sexual, drive and cause sexual dysfunction. It can also cause plaques or calcium deposition in your blood vessels of the limbs, especially lower limbs or legs, which can cause problem in walking. So these are all problems which can happen if you don't treat it or if you miss it. So it is very important that you keep an eye on your blood pressure, and please subscribe this channel and press the bell icon and try to share it with your friends. I'll be very grateful for that, and that will be big help for them as well, to be honest. I'll keep you posted with the next vlogs, which will talk about these lifestyle changes which we have discussed, which you can through which you can monitor and reduce your blood pressure and control your blood pressure without taking medications. It can affect 10 to 15 mmHg of blood pressure reduction, just with the lifestyle changes. And similarly, we'll discuss about obesity. We'll discuss heart diseases, their preventions, and especially the treatments which you can use at home rather than medical treatments, or which can help or enhance the effect of medical treatments. Similarly, kidney diseases and other. So a lot of useful vlogs are coming, but stay tuned and stay blessed. Thank you for now. Bye.